one of the issues that actually has some agreement on analysts in both parties is that the best way to help Medicare is to slow down healthcare spending. Many of us have seen the reports that indicate aging per se is not really what is going to do us in. It is the spending gap, the 2.5 percentage point growth faster than the rest of the economy that we have in healthcare, have had for the last 45 years, combined with the aging baby boomers, that we can't sustain. So it really indicates that the importance of finding strategies that will slow down spending is not just that it will help us extend coverage to the 45 million people without health insurance coverage, but it'll also be an important part of helping us with Medicare. Karen had raised an issue that's important that I forgot to respond to, which is if we are going to slow down spending, the people who've been used to having the 2.5 percentage point excess growth, the institutions and the physicians and the industry sector, are probably not going to be happy about this. And how are we, or will we be able to respond to the pressures they'll bring to the system? My belief as an analyst and policy person is that only with good, credible information through comparative effectiveness or other information on quality and value and outcomes, if we can show in convincing ways that what is being reduced has little value, we have a chance. Otherwise, we know what the argument will be. Some payer, private, government, whatever, is trying to keep some physician or other health practitioner from doing what he or she thinks best for that person, and that's why we're not doing something. I don't know whether good, credible data will be enough. I am absolutely positive that in the absence of good, credible data, that certain procedures we've been doing, interventions we've been doing for some subsets of the population have very little value, maybe primarily harm. We have no chance without that.
I'm impressed as a historian, but also as a businessman formerly, that we've, at 60 years of failure to enact national health insurance, and I wonder, since you're longtime observers and very familiar with some of the workings of government, if either of you has some observations or suggestions about what to do differently.
At various moments in time, there are pieces of legislation that can be passed. And the real issue is whether there is an ability, typically by the White House, to recognize the best package that is likely to be able to be passed at a moment in time and decide after whatever first efforts are made to get what that administration really wants, whether they will embrace and try to drive forward with the best that they can get or not. We could have, in my opinion, had in 1993 and 94 a federally funded health care benefit for everyone who was poor in some parts of the low income, and a variety of insurance changes as well, at the very minimum, maybe a little more than that, but definitely not universal coverage. And because it was not that, it really was not allowed to push together a coalition of Republicans and Democrats that could have passed legislation. In 2003, and I don't want to pretend like I am enamored with the Medicare Modernization Act, because I am not. There are more warts on that bill than most pieces of legislation have. But there was recognition that that was the best bill, or the only bill that was likely to be able to get through the Congress at that point in time. And a majority, although just barely a majority and with a lot of last-minute pushing, decided that rather than wait till 2009 or 10, which is when the next opportunity would have been, to go forward and try to deal with various problems after the fact. We are not going to have the neater looking version of national health insurance in this country in any time in my vision going forward. I think we can have all or most people with insurance coverage. And the question is whether we will aggressively move forward in the pieces that we can do when the opportunity presents itself.
I see several reasons to be optimistic. One is of course, the the problem is worse now than it was 15 years ago, and that makes more people be ready to do something. So on the more hopeful end, there's a lot of bipartisan interest, and Gail remarked on this, there's a lot of bipartisan interest in getting things done. So you have Senators Wyden and Bennett with a bill that would essentially cover everybody. You have about, 10 or 15 bills on health information technology and on changing payment system and delivery system reform. So you've really got a lot of activity going on. In addition, you've got people being involved in politics for, in many cases, the first times in their lives. I mean, the message that we are trying to send, that Senator Obama is trying to send to everyone, is we need citizens to be involved in government. We need everyone to be involved in government. And if you want to be part of the solution, then you are welcome to join the discussion. He wants a table that is open, where people discuss it, where we go forward trying to find what is the consensus. And I think that is a very hopeful way to proceed, and that makes me more optimistic than we've been in some time.
I feel enormously enriched by this symposium today, and I'm enormously grateful both to the speakers and to the expert panel here who've helped us move ahead. Thank you.